Imagine this. You are at home, the evening is quiet, the TV murmurs from across the room, and suddenly a heavy pressure blooms beneath your breastbone. It creeps toward your left arm, your breath turns thin, a cool sweat beads on your forehead, and a stampede of what-ifs tramples through your thoughts. You are alone. What you do in the next 60 seconds could decide the next 60 months or years of the life you still want to live. I am Dr. Elise, and in the next few minutes, I am going to give you a clear, repeatable playbook that turns panic into purposeful action. Most people freeze or fumble the first move. The good news is that there are simple, science-informed actions that reliably buy time, protect your brain, and get help through your door faster. One step you will learn today takes under 10 seconds and repeatedly shaves precious minutes off response time. Another lowers your heart's oxygen demand within 2 slow breaths. If practical, life-saving health content is your thing, tap subscribe right now and hit the bell. The next video you miss might be the one you wish you had seen. For now, place one hand on your belly and one on your chest so we can practice together. I will keep my voice calm and precise. You will not need to remember everything. You will just do it, because after this video, it will live in your muscle memory. Let us start with your environment, because in a crisis, your surroundings either help or hinder. Write your complete address in big, high-contrast print. Include street, number, unit, building, and gate code, if any. Add your phone number. Tape a copy beside every phone, one on the refrigerator, and one on the inside of your front door at eye level, so responders can see it the instant they step inside. Program your cell phone for one-press emergency calling. When your hands shake, fewer taps matter. Keep your phone charged and within reach at night. If you live alone, consider a medical alert device and wear it always, including in the shower. Emergencies do not make appointments. Tell a trusted neighbor or your building manager that paramedics may need fast access. Give a spare key or install a lockbox, and if available in your city, register the code with your local responders. Create a compact EMS info pouch by the door, labeled in large letters. Inside, place a printed medication list with exact doses, your allergies, your conditions, your clinicians and their numbers, 2 emergency contacts, and a copy of your ID. Add a spare pair of reading glasses and a working pen. Mark the pouch location with a bright sticky note that says EMSINFO, so strangers can find it at a glance. Finally, choose the exact spot where you will sit if symptoms begin. You want a place where you can support your back at about a 45-degree angle, with a pillow within reach and a lamp you can turn on fast. When seconds matter, familiarity prevents scavenger hunts. Posture and clothing are your next quiet allies. They are small physical choices that reduce strain and make breathing more efficient. If chest pressure, unusual breathlessness, nausea, a cold, clammy sweat, pain, or heaviness radiating into your arm, jaw, or back, or a wave of unexplained fatigue hits and you are still alert, avoid lying flat. Sit back at roughly a 45-degree angle. Bend your knees with feet flat. Let a firm pillow support your mid-back and head. Loosen anything restrictive. That can be a belt, waistband, tight bra band, zip hoodie, scarf, or tie. Free your belly and ribs to expand without fighting fabric. Crack a window for fresh air if it is safe, and turn on lights so responders spot your home quickly. Keep the room cool rather than warm, since overheating forces your heart to work harder. If you feel lightheaded, do not wait for gravity to choose. Lower yourself to the floor slowly, using furniture for support, and roll onto your side in a recovery position with the bottom arm forward, top knee bent, and chin slightly lifted to keep the airway open. Place your phone on speaker so both hands are free. One can manage clothing and posture. The other can handle medication if that is part of your plan. None of these moves cure a heart attack. They buy a more favorable physics while help is on the way. Think of them as easy gears you can shift into without thinking. Practice the setup now. Sit in your chosen spot, position the pillow, loosen a belt, and rehearse the motion of easing down to the side if dizziness rises. Your body learns by doing, not by promising. Now let us train the lever you always carry, your breath. When fear surges, the body begs for fast, shallow gasps that actually worsen oxygen delivery. Fight that reflex with paced diaphragmatic breathing. Inhale through your nose for a steady count of 4, feeling your belly rise more than your chest. Hold for a count of 4 to let oxygen diffuse across the lungs. Then exhale through pursed lips for a count of 6, as if blowing out a birthday candle in slow motion. That longer exhale signals your parasympathetic nervous system to dial down heart rate and vascular squeeze. Put one hand on your chest and one on your belly. Let the belly hand lead and move more. Counting softly out loud helps you keep tempo and tells a dispatcher you remain conscious. Practice 5 minutes a day for a week so the pattern is automatic. Tape a small card near your chair that reads 4-4-6 belly first. Paced breathing does not replace medical care. It bridges the gap by improving gas exchange, lowering oxygen demand, and interrupting the adrenaline spiral. Even 2 good cycles can interrupt the surge. You are not trying to relax away a cardiac event. You are optimizing fuel delivery to heart and brain while help races toward you. Bonus, use this same pattern during blood pressure checks, anxiety spikes, or painful procedures. You are building a multi-tool skill that pays dividends in many moments, not just emergencies. Access is everything, so remove friction ahead of time and in the first moments of a suspected event. The instant you suspect a cardiac emergency, and preferably even before you place the call, unlock the front door. If you can walk safely, do this first. If you cannot, tell the dispatcher your door is locked and say where the key or lockbox code is located. Flip on porch and hallway lights so your home stands out. In daylight, hang a bright towel or sheet on the door or window so your address broadcasts itself. If you live in an apartment, after calling emergency services, immediately notify the front desk or security so someone can meet responders and guide them straight to your elevator and unit. Give a simple script. I am in Building B, left elevator, 3rd floor, Unit 3C. The door will be unlocked. If gates or multi-door entries exist, details matter. Write a tiny script by your phone so you can read it verbatim even if you feel foggy. Keep a whistle on your nightstand and key hook. If breath is scarce, a short burst can lead rescuers to you faster than a whisper. Tape your EMS pouch inside the door at eye level. Responders are trained to look there. Imagine the path from the street to you. Every friction you remove returns seconds to treatment later. Seconds matter more than we like to admit. Let us cover aspirin, the classic step with crucial caveats. This video is education and your clinician's guidance rules for your body. If aspirin is appropriate for you in suspected cardiac symptoms, chewing rather than swallowing accelerates the effect because some absorption begins in the mouth before the gut. Many people use one regular strength tablet, commonly 325 milligrams, or 4 baby aspirins of 81 milligrams each, chewed thoroughly, even if the taste is unpleasant. If you have been told to avoid aspirin because of bleeding risk, allergy, ulcers, medication interactions, or a personalized plan, do not take it. If you are on anticoagulants or have complex cardiac instructions, follow your clinician's written protocol without improvisation. Label your aspirin cap with a marker to remind yourself to chew. Store non-enteric tablets in their original bottles in dry spots you actually use, like your bedside table, living room drawer, purse, and car kit. Check expiration dates twice a year. If you are unsure during an event and can still speak clearly, Tell the dispatcher your history and ask them to confirm the plan you already discussed with your doctor. They will not practice medicine over the phone, but they will help you stick to your pre-approved steps. Remember that aspirin is not a cure. It is a bridge to professional care. It may help slow platelet clumping while trained hands and medications address the root cause. Combine aspirin if appropriate with posture, breathing, and rapid access, not in place of them. Now, the notorious cough CPR. The internet oversells this idea, and reality is narrower. Cough resuscitation can help a conscious patient momentarily maintain circulation in certain monitored heart rhythms, typically in clinical settings with professionals guiding timing. It is not a universal at-home fix and should never delay or replace calling for help. If you remain fully conscious and symptoms begin abruptly, 1 or 2 deep breaths followed by forceful coughs from your diaphragm may in theory briefly support blood flow while you are already activating emergency response. But your priorities must remain non-negotiable. Call or trigger help. Unlock the door. Assume protective posture. Begin paced breathing. Chew aspirin if cleared. Use nitroglycerin if prescribed. And signal responders in. Treat any cough maneuver as a footnote, not a headline. I know it is tempting to cling to a single self-rescue trick. The real life-saving comes from fast activation, frictionless access, oxygen-smart breathing, and correct use of the tools your clinician has already placed in your pocket. If you practice anything, practice the 1-minute choreography I will give you shortly. It is consistent, teachable, and safe for almost everyone while you wait. If your clinician has prescribed nitroglycerin for angina or emergency chest discomfort, know the protocol cold. Sit before dosing because standing can trigger a sudden blood pressure drop and a dangerous fall. Place 1 tablet or 1 spray dose under the tongue and let it dissolve. Do not swallow. A mild headache or tingling often signals potency. Set a 5-minute timer. If symptoms persist, take a second dose. Wait another 5 minutes, then a third if needed. Never exceed 3 doses in 15 minutes. If pain is ongoing or returns, emergency services should already be on the way. Do not postpone that call to see if it passes. Store nitro in its original amber glass. Air, light, and heat degrade it quickly. Replace every 6 months and mark the new bottle with a date sticker. Never combine nitroglycerin with erectile dysfunction medications within the safety window your clinician specifies. The mix can dangerously collapse blood pressure. Keep a wallet card listing every medication you take and the timing of last doses. Responders need that data fast. And pair nitro with the basics: supportive posture, loosened clothing, paced breathing, and an unlocked, well-lit door. These are not separate lanes. They are one coordinated response. Let us compress everything into a 1-minute choreography you can practice until it is automatic. You feel pressure, breathlessness, radiating discomfort, dizziness, cold sweat, or stubborn nausea. Say out loud, "This could be my heart." Naming it breaks denial. If you can move safely, unlock the front door and turn on lights. If you cannot walk, call immediately and tell the dispatcher the door is locked and where the key or code is kept. Sit supported at 45 degrees, knees bent, loosen belt and collar. Begin the 4-4-6 breathing cadence and place a hand on your belly to guide movement. If your clinician has cleared you, chew the appropriate aspirin dose now. If you have prescribed nitroglycerin, take the first dose under the tongue while seated and start the 5-minute timer. Keep breathing to cadence and count softly. It steadies you and reassures the dispatcher you are conscious. If dizziness rises, ease to the floor and roll to a side-lying recovery position. Keep your EMS pouch within reach for responders. If you hear knocking and cannot project your voice, use the whistle. That is the script. Unlock, call, sit, loosen, breathe, 4-4-6, chew if cleared, Nitro if prescribed, stay on the line. Side if dizzy, signal. Simple, repeatable, yours. Now I will guide you through a 60-second practice so your body knows the sequence. Sit comfortably where you are. Place a pillow behind your back. Ready. Say out loud, "This is practice." Stand up if it is safe. Walk to your front door and mimic unlocking it. If you cannot stand, imagine pressing your smart lock or handing a code through the phone. Return to your chair and sit at a 45-degree angle. Loosen an item of clothing, even if only a hoodie zipper, to feel the motion. Put the phone on speaker. Begin the breath count. Inhale for 4, hold for 4, exhale for 6. Repeat once more. If you have a bottle of baby aspirin that your clinician has approved for you, touch it and say, "Chew, do not swallow." If you have nitro in its original bottle, touch it and say, "Sit before dose, never more than 3 in 15 minutes." Now look toward your door and imagine responders arriving. See the porch light on. Picture your EMS info pouch at eye level on the inside of the door. Feel the clarity of a path that you created. You just rehearsed what most people only worry about. That is the difference between fear and readiness. Let us add 2 mini scenarios to remove doubt. Scenario 1. You are in bed at 2 a.m. A tight pressure wakes you and you are sweaty. Your phone is on the nightstand. You say to yourself, "This could be my heart." You sit up to 45 degrees against the headboard, knees bent. You grab the phone, press the one-touch emergency call, put it on speaker, and say your address from the card taped to the nightstand. You loosen your waistband, crack the window, and begin 4-4-6 breathing. You chew aspirin if your plan says yes. You take nitro if prescribed while seated. You unlock the front door by voice command through your smart home, or you walk carefully to unlock it. Lights on, then return to the bed or couch. You stay on the line and count your exhales out loud. When dizziness rises, you lower to the side lying position. That is a clean execution of the plan. Scenario 2. You are in the living room, afternoon light. You feel jaw tightness, upper back pressure, and a strange wave of fatigue. You tell yourself, name it. You unlock the door first and switch on the porch light. You sit at your designated chair with the pillow behind you, loosen clothing, and put your phone on speaker. You do the breathing cadence and speak your address. You chew aspirin if appropriate, and then follow nitro protocol if prescribed. Your EMS pouch waits inside the door. Your neighbor, who knows the lockbox, is already texting you because they saw your light signal. You are never powerless when a plan lives in your home. Now let us build your kits so they are frictionless to use. Make twin cardiac kits, one by the front door and one by your bed. Include aspirin if appropriate, your current medication list, your allergy list, diagnoses, clinician contacts, emergency contacts, a compact pen, a laminated card with the breathing pattern and the 1-minute choreography, and a spare pair of readers. If you use nitroglycerin, keep it separately in its original bottle with a replacement date sticker. Add a small power bank and charging cable so a dying phone never steals your call. Put a lamp on a smart plug you can voice activate. Tape a second address card to the fridge and a third inside the door. Tell your neighbor where the lockbox is and what to do if they notice your blinds still drawn at noon. Set a weekly 1-minute drill on your calendar. During a TV commercial, walk your route. Unlock, sit, loosen, breathe, speak the address, check the kit. This is not paranoia. It is maintenance, just like replacing smoke detector batteries. Teach the mantra to your circle. Unlock, call, sit, loosen, breathe 4-4-6, chew if cleared, nitro if prescribed, stay on the line, side if dizzy, signal. The more people who know it, the safer you are when seconds count. Mindset matters as much as mechanics, and community seals the deal. Many seniors do not want to make a fuss or fear embarrassment if it is just indigestion. Promise me this. It is better to be told you are okay than to regret waiting. Symptoms in women and in people with diabetes can be subtler. Pressure, fatigue, breathlessness, and nausea can be the only signs. If it feels wrong and persistent, act. If you are preparing for a spouse, parent, neighbor, or church friend, create a buddy system. Quick check-ins morning and evening. A green, yellow, red code by text. A promise that red means I am on my way and I am also calling. Post a gentle sign near the doorbell. Medical info just inside. If you have had a scare, ask about cardiac rehab. It rebuilds confidence alongside capacity. Anxiety after an event is normal. Structured guidance calms mind and body. You are not alone here. Our community lifts one another with preparation, not perfection. If this was helpful, please like this video so more seniors find it, and subscribe to Senior Vitality Pro. We publish actionable, compassionate health skills you can actually do. Because this channel is a workshop and not a clinic, everything here is educational and not personalized medical advice. Your clinician leads your specific plan. Bring this checklist to your next visit and ask direct questions. Is aspirin appropriate for me? Should I carry nitroglycerin? What exact order do you want me to act in? Are there any medication interactions I must memorize? Ask the clinic to print your medication list and staple your emergency instructions to it. Then put copies in both kits. If you use a smartwatch or phone with health alerts, set thresholds and add a secondary notification to a family member. If your area supports registering lockbox codes with first responders, do that. Audit your home for trip hazards near the path you would walk to the door. Label light switches clearly. If hearing or vision is limited, add visual or vibrating alerts. If English is not your first language, keep a translated address card and a simple phrase card by the phone. Preparation honors your future self. It is practical kindness in advance. Let me give you a short guided breath script you can play in your head whenever you feel a wave of anxiety or discomfort. Hear my voice. Sit back with support, knees bent, feet flat. Place one hand on your belly and one on your chest. Inhale through your nose for 4. 1, 2, 3, 4. Hold for 4. 1, 2, 3, 4. Exhale like blowing out candles for 6. 1, 2, 3, 4, 5, 6. Again. Inhale 4. Hold 4. Exhale 6. Soften your shoulders. Unclench your jaw. Notice belly movement. Keep the exhale longer than the inhale. If you are on a call with emergency services, count out loud so they hear you and you stay anchored. Let each exhale be a signal to your heart that you are safe enough to wait for help. 2 more cycles. Inhale for 4. Hold for 4. Exhale for 6. Last one. In for 4. Hold for 4. Out for 6. Well done. This is not a cure. It is a bridge. It buys clarity in your mind and a bit of relief for your heart. Now a brief myth check so you do not lose time in fantasy solutions. Myth 1. I can walk it off or splash water on my face. Reality. Movement and delay increase demand on a struggling pump. Sit, breathe, call, unlock, and follow your plan. Myth 2. If pain is not severe, it is not my heart. Reality. Some events present as pressure, heaviness, fatigue, or shortness of breath more than pain. Treat suspicious symptoms as cardiac until proven otherwise. Myth 3. If aspirin helped my friend, I should always take it. Reality. Only if your clinician has cleared you. Interactions and bleeding risks are real. Myth 4. Coughing hard can restart my heart every time. Reality. It has very narrow use. Do not delay calling or other steps to cough. Myth 5. I can wait for someone to come home. Reality. Early minutes matter. Activate help now. These myth checks are simple phrases that can save you from losing the precious window that turns a bad day into a catastrophe. Finally, let us lock the rhythm into your memory one more time. Whisper it with me, even if you are alone right now. Unlock, call, sit, loosen. Breathe 446. Chew if cleared. Nitro if prescribed. Stay on the line. Side if dizzy. Signal. Write it on 2 index cards. Place one in your wallet and one on your nightstand. Set a repeating weekly reminder to run your 1-minute drill. Put your EMS info pouch on the inside of your front door. Place your kit by the door and your twin kit by your bed. Program the lamp, register the lockbox. Tell your neighbor your plan in 1 sentence. If I send the red code, please call and meet responders. Text this video to 3 people you care about. In the comments, tell me which piece you are setting up today: the address card, the lockbox, the breathing practice, or the 1-minute drill. I read every note, and your tip may be the one that saves someone across the world tonight. If this gave you clarity or calm, tap like so the algorithm shows it to more seniors in time. I am Dr. Elise, and I want you here longer, stronger, steadier, and prepared. Preparation is not fear. It is love in action. I am proud of you for investing these minutes. Now make them count. Stand up, grab a card, write your address, tape it where you will see it, and run your first 60-second drill right now. I am cheering for you, and I will see you in the next video. So subscribe and keep practicing the life-saving basics we just locked in together.